for their daily news conference. Thank you for joining us this morning, sir. And we have a few phone calls for you. Let's go to Toya, who waited through the break. Good morning, Toya. Do you have a question?
Good morning. Yes, I do. I want to know what is the best vitamins, immune system booster that we can take to help our body right now? Because everybody running out trying to get vitamins and everything. So I'm trying to figure out what is best for us to get.
Great question. What do you say, sir?
I don't think there's any one particular vitamin or nutritional supplement that's been proven to boost the immune system. Of course, vitamin C is always important. That's been known for quite some time. But the most important thing is to, as best you can, eat a healthy diet that's well balanced, because that appears to be the best way to support a functioning, highly functioning immune system. But there's no one vitamin or supplement that I can recommend that's been proven to help you fight viruses. But I can say definitively that having a balanced diet that's nutritious does in fact help us to fight off all kinds of bacteria and viruses. So my recommendation is that everyone should, to the best extent possible, just try to eat a nutritious diet or have a nutritious diet. And that's the best option for us right now.
Yeah, and couple that with some exercise, right?
Yes.
Stay healthy that way as well. Now, good advice. All right, let's go next to JC. JC, good morning. Do you have a question for the doctor, JC?
Yeah, I've got a couple of things, I think.
Okay.
I've been watching this coronavirus. One of the main things is transportation. All the four, air, bus, train, travel like that, you need to shut them down, because that's just like your blood arteries. Cancer gets into your blood, it travels. All right, this is into our travel system. Shut them down, keep them from moving. Also, the other thing is PPEs. People, your filters have that little silver thing on top of them for one thing: pinch it over the nose. Get a filter that fits your face.
Yeah.
Keep your hands away from your face when you're out. Keep it away from your filters. Those filters can also be cleaned by sterilizing them, so you don't have to throw them away all the time.
Doctor, let me ask you on the filters one too, especially if you're wearing one of those white ones with, like he said, the band on top, and you wear it, do you, when you're done with that, do you have to take it off and throw it away, or can you use that again?
They can be used again, but technically they're designed, at least the ones that the healthcare professionals are using. Those are really meant to be, use them once and throw them away, because that ensures that you're not carrying over infections from day to day. But in the times that we're in, where things are so short, they do have to be worn multiple times. And there, the best advice is to wash your hands before you handle them, and wash your hands after you remove them. And that way, the main thing is to keep the virus out of our systems, and that's what the mask is for. But if you handle it and it's contaminated, you then have it on your hands. And so it's really critical that people wash their hands before they put on their face covering or their mask, then wash your hands after you remove it, just to be absolutely sure there's not going to be any cross-contamination between it and you. So, and they do need to fit snugly on your face, whether it's a mask or a homemade covering of some sort. That's very important. And the other thing is that, to the extent that you can, if you're going to wear it multiple times, it is desirable to clean it between when you wear it once and wear it again, if at all possible. But you hear stories that in some hospitals, the healthcare providers, healthcare workers have been giving a single N95 mask to wear for a whole week. And that's really less than ideal. And because of the way these things are made and the materials they're made out of, they can't throw them in a washing machine, or you can't really spray them with a Lysol spray, because that can cause some harm to the wearer. So it's extremely challenging. And in that scenario, again, the best thing to do is to take precautions before you handle them. And again, after you handle them, by washing our hands thoroughly each time.
Hey, doctor, real quick on this, and we'll get to more phone calls. Several people have messaged me asking me this question on Facebook. Do we know now for certain, one way or the other, once someone has had the virus and recovered, do they have an immunity to it?
The evidence is starting to accumulate that there is some immunity to the virus when people recover. And the best evidence of that is that those individuals who've convalesced and gotten better, there are antibodies in their blood that is being evaluated for its ability to neutralize the virus. As a matter of fact, here in Nashville, at Vanderbilt, at Harvard, many other places, they are transfusing serum from those who recovered into those who are suffering from COVID-19, testing whether or not those antibodies in that serum can be beneficial to the person who's dealing with the virus currently. And it's too soon to say whether or not it's working, but I can tell you this approach has been taken for at least 100 years, where you take serum from somebody who's had a virus and give it to someone who's fighting it to give them the antibodies they need to fend off the virus. So, and I can say from the SARS pandemic in 2002 and then in 2012, for MERS, we know for sure that the antibodies that those people produce can in fact neutralize the virus. So we have every expectation the same thing is going to be true here for COVID-19. And this is critically important because if we establish that the viruses induce neutralizing antibodies and they're protective, and we can demonstrate that somebody has those antibodies, then presumably they can be released to go back to work because they don't represent a danger of getting infected or infecting anyone else. So this is a really, really critical part of the research right now, is to determine whether or not the immune response that has been made is in fact protective, because if we can demonstrate that, then we can start to let people go back to their normal lives, to the new normal, as I call it, when we can demonstrate that. So that's a really important area of research right now.
Excellent. Let's take another phone call for you, sir. We'll go to Laura next. Laura, do you have a question for the doctor?
Yes, I do.
Okay.
First of all, thank you, doctor. You break things down clearer than anyone I've listened to, so I appreciate that.
Thank you.
I am an autoimmune disease person. I have psoriatic arthritis, and I take diclofenac to try to suppress my immune system. During all this, I have been, if I get a scratchy throat or anything, I quit taking that, and I use my zinc and everything else to boost my immune system. So therefore, I'm having more aches and pains. But, I mean, is that what I should do, try to keep my immune system up at this point, even though normally I'm trying to take it down for the pain? Thank you.
Interesting. Thank you for your call, ma'am.
Sure. The caller points out something that everyone needs to understand about the virus, that our immune system is our best chance of fighting any virus, the immune system that God gave us. And if you have a condition that suppresses your immune system naturally, or if it's being suppressed with drugs, that puts you at higher risk of getting severe disease from coronavirus. So that's why individuals who are taking drugs that suppress the immune system, or if you suffer from an autoimmune disease, those individuals need to be particularly cautious to avoid getting infected, because we know that in those individuals, the disease could be quite severe. So I think the caller is correct in understanding that if she's taking a drug to suppress her immune system, that creates greater risk. And if the pain is acceptable for some time to not take those immunosuppressive drugs, that's probably a smart idea. But of course, some individuals can't not take their drugs because the diseases are so serious. And that means that they need to be particularly cautious about exposing themselves to someone who might have COVID-19, which brings me, again, an opportunity to make a very important point. We can't look at a person and tell if they have the virus. There may be no cough, there may be no fever, there may not be any outward sign that the person is carrying the virus, yet they're able to transmit it to the people they interact with. And that is why it can't be emphasized enough times. The social distancing is critically important for that reason, especially because there are asymptomatic carriers who can transmit the virus, and they're not doing this intentionally. They just have no awareness of the fact at the time that they have the virus. Now, eventually, in as short as 2 days, but as long as 12 days, they'll get symptoms. But in the pre-symptomatic phase of the infection, they can clearly transmit the virus. And so to protect individuals who are at high risk for disease and death, that is why all of us need to behave as if we're infected. so as not to give it to the people that we care about.
Excellent point. All right. And by the way, when someone does, doctor, have it and they don't know it, when you say they'll spread it, let's just say I happen to walk past someone in the grocery store who is asymptomatic but has the virus. All right. And I walk past them and I have a mask and they're not sneezing and they're not touching me. But let's say I walk within 2 feet of them. How is the virus going to get on me?
So the answer to that is not entirely clear, but what the evidence suggests is that even the act of normally breathing, there are some viruses that are being exhaled into the air, and they persist in the air for some time. So I've heard estimates that vary from 30 minutes to much longer than that. If you happen to breathe in that air that contains the virus, you're actually taking it to exactly where it wants to be, because the virus infects the cells in the lungs. And so when you inhale air, the air goes down into your lungs. And so you're putting the virus just where it wants to be to begin an infection. So if you're wearing a face covering, that diminishes the likelihood that if you come into space where the virus is present in the air, you're much less likely to breathe it in because your nose and your mouth is covered. And that's the point of all this. Since we don't know who might be in that category, asymptomatic but spreading the virus, if we all wear face coverings when we're out, everybody is safer because of that. And that's why in South Korea and China for some time, I think they're still doing it, you can't go out unless you're wearing a mask. It's actually enforced as a way to protect the whole population. And that's kind of where we are right now. No one's being forced to do it, but I think we should choose to do it because we'll save lives by doing it.
Doctor, we just have about a minute before I know you have to run, and we'll take some of these calls after he goes to touch on some of what he's discussed. Real quickly, with just what you see happening in Metro and maybe statewide, we all know this week and maybe next going to be very difficult, but are we seeing some positive signs, and is that going to be some of what you guys talk about at the news conference at 9:30?
Yes, the models that are being used for the state of Tennessee seem to indicate that we are having an effect in flattening the curve. But people should not, get too excited because there's still work to be done. And as I'm going to point out in the briefing today, the models are based on assumptions that we're all going to do what we need to do and stay home and keep apart. If we stop doing that, then the model falls apart and we'll be right back where we started. So the models are confirming that what we're doing is working. So let's not stop doing that because the evidence seems to be accumulating that it actually is working. And so Nashville, we got this. Don't be a vector.
Gotcha. Dr. James Hildreth, thank you so much for coming on. We so appreciate it. You're terrific, and I agree with the last caller. I mean, you just do a great job of explaining it. Hopefully we can see you again, if we can, even on a weekly basis. But thank you so much for your time.
My pleasure. Thank you.
Thank you, sir. All right, we're going to take a break. When we come back, I know many of you were on hold there. I'm sorry, the doctor has to run now to go to that news conference, but we'll be back with more. We can talk about that, some of the new developments that I also know of. And if you have any questions, perhaps, about the stimulus checks or unemployment, some new information along those lines as well. The phone lines will be open for the rest of the way. If you're on hold, stay there. We'll get to you right after this.